A patient who develops the first symptoms of balance problems will usually seek the advice of their general practitioner. So the general practitioner will take a history, examine the patient, and if they do identify problems with their balance, then they will almost certainly generate a referral to the local neurology service. And then the patient will be seen by usually a general neurologist who will also take a history, do a detailed examination, and initiate some investigations looking into the cause of the ataxia. What happens then is that if the local general neurologist is able to identify a cause of ataxia and can address the problem, then the journey stops there. If the cause of the ataxia remains unknown, then sometimes the neurologist will seek advice from a more specialized center.
If you've seen the neurologist and you feel that you would perhaps like another opinion about your ataxia, then you could always ask for a second opinion and to be referred to an ataxia centre where you would meet someone with a lot of expertise around ataxia, and hopefully you would speak to an ataxia nurse as well.
What we can provide for the patient is to address specific symptom problems. For example, a patient can have problems with something called oscillopsia, where they have a jumpy vision, or sometimes that can manifest with a blurring of the vision. There's medication we can sometimes use to help that. Some ataxias are associated with bladder dysfunction or postural hypotension, so drop of the blood pressure when the patient stands up. So again, there's pharmacological agents that we can use to help with that. In addition, the input of physiotherapies, speech and language therapies for slurred speech, swallowing difficulties is essential for symptom management in those cases.
We would say that it's important to refer somebody early on to a speech and language therapist. We would generally say if they're starting to be aware of changes in their speech and they're concerned about it, or if they're starting to notice any changes with their swallowing, then that's a good time to make a referral to us. We can give them some initial advice, we can give them some good pointers for trying to prevent future problems or ways of coping with those changes to their speech and swallowing. And if we get in there early on, it's easier for people to take on board those strategies, I think, and to be able to do something to maintain things as well as they'd like to.
From the point of view of the speech problems, then we would offer the services of a speech and language therapist. Again, some of them deal with specifically with neurological conditions, so they have a great deal of expertise, and helping people to get their confidence around the speech can be helpful. So we would always offer that service.
One of the approaches that we take is sometimes to work on exercises, typically to help with something like getting better breath support for speech, to help people with breathing exercises, to encourage them to pause in the appropriate place to allow themselves to take another breath in order to manage to get to the end of the sentence without running out of breath. We might look at exercises to keep speech more tuneful and to help with stressing the important words in a sentence, for instance. But often what we're doing is giving people strategies to use to help them to continue to be able to communicate as well as they want to be able to.
We always offer physiotherapy, particularly to a neurological physiotherapist who has experience of working with people with neurological conditions can be helpful.
overall, problems that people could experience are limitations in their participation of daily activities or leisure activities, social activities, or their normal day-to-day lives and roles. They're the sorts of things that a physiotherapist would want to try and help with.
In our service, we would visit the person in their own home. We would look at their current abilities, what they were finding difficult, or what they were wanting particularly to work on. We would consider their home environment, any kind of safety issues, particularly around the kitchen or, getting in and out of the house, or whether there's any kind of bathing equipment, that kind of thing. We would then, if it was further afield and they wanted to go more outside the house or go to issues with work or leisure activities, then we can address them. But we would do that by finding out how the person does them activities at the moment and breaking down the components that they were finding difficult in order to try and problem solve around that to enable them to do it more effectively, really.
If you find that you're having a particular emotional difficulty, such as depression or anxiety or embarrassment, you might find something like a talking therapy with a counsellor or a psychologist can be helpful. You can talk to your GP about accessing those sorts of treatments. Your GP can also be helpful to talk to about medication options for things like anxiety and depression. So sometimes people can find antidepressants or medications for anxiety helpful.
Some people may be very worried about the future, and they may have ideas that are actually that things are going to be much worse than they actually are. So sometimes we can be reassuring to people about how we would expect their condition to progress in the future.
So overall, we work together as a team to try and help people overcome the barriers that their condition presents so that they can keep doing the things that matter to them in their everyday lives.